Union Health Minister, India. Ladies and gentlemen, it is now my singular pleasure to welcome His Excellency Mr. Joe Bijang, Honorable Minister of Health and Human Services, Republic of the Marshall Islands. Your Excellency, please. Ladies and gentlemen, Mr. Joe Bijang, Health Minister of the Republic of the Marshall Islands. It is now my honor and privilege to welcome Dr. Poonam Khetrapal Singh, the Honorable Regional Director, WHO Southeast Asia. Dr. Poonam Singh, please. Madam Regional Director. May we please welcome our distinguished delegates from the countries in the order of the English alphabet. From Denmark, Mrs. Nina Bergstad, Senior Advisor, Office for Data Infrastructure and Cybersecurity, Ministry of the Interior and Health, Denmark. From Mozambique, Mrs. Bernardina de Souza, National Deputy Director for Health Training, Ministry of Health, Mozambique. Mr. Bader Avlathani, Director General of Information Technology from the Sultanate of Oman. Dr. Preetha Rajaraman, Health Attaché and Regional Representative, Department of Health and Human Services of the Secretary of the for Global Affairs, Embassy of the United States in India. And the representative from the European Union, the European Union's delegation in India, Dr. Benoit Savaroche. Ladies and gentlemen, allow me to welcome the moderator for this high-level plenary session. This high-level plenary, Dr. Prem Namgyal, Director for Program Management, WHO Regional Office. For more discussions on critical transformational milestones in digital health, ladies and gentlemen, I have the pleasure in handing you over to Dr. Namgyal to moderate this high-level plenary. Thank you, ladies and gentlemen.
Thank you, Gautam. Your Excellencies, distinguished delegates, ladies and gentlemen, it is my pleasure this morning to moderate this extremely important high-level plenary session of this two-day meeting on digital health. The MC has already introduced all the distinguished speakers for this high-level plenary session, and I will straight away jump into requesting the distinguished speakers. First of all, Dr. Mansukh Mandaviya, the Honorable Union Minister of Health and Family Welfare and Minister of Chemicals, Fertilizer, Ministry of Health and Family Welfare, Government of India. Your Excellency, yesterday we were fortunate to hear your opening address where you highlighted many of the notable achievements that India has made in such a short time frame, which not only benefited India, but also many countries beyond the borders of India. Today, we are doubly pleased and fortunate to have Your Excellency with us physically, despite your very busy schedule to be here with us. And I would like to request Your Excellency to give your thoughts in your keynote address to this plenary session this morning. Therefore, Your Excellency, once again, thank you very much for being with us, and over to you, Your Excellency. Yeah.
Good morning, everyone. sitting on dais, dignitaries, ladies and gentlemen. It gives me immense pleasure to be here with distinguished guests on the second day of Global Conference on Digital Health, which has provided a global platform for enhanced cooperation and technology-driven solutions in health sector aimed at taking universal health coverage to the last mile. Digital health interventions are not just limited to individual healthcare delivery programs, but are spread across multiple health outcomes, catering to both communicable and non-communicable disease across the health and disease burden spectrum. India has taken a quantum leap towards leveraging digital health solutions for effective health service delivery. I would like to highlight a few achievements of the country in the digital health and service delivery domain, which showcase India's capacity to scale technological advancements for a country of 1.35 billion people. In the maternal and child health domain, India has created name-based database of 200 plus million eligible couples, 140 million pregnant women, and 120 million children who are being monitored for antenatal, postnatal, and immunization-related health services. Another key example is the Nikshay intervention under the National TB Elimination Program, through which more than 11 million patients are tracked for adherence to TB treatment. India's focus on comprehensive primary health care is underlined with the NCD application, through which more than 15 million population with 30 plus age has been screened for 5 NCDs, in turn creating a health profile for India. Using integrated health information platform, which was developed in collaboration with the World Health Organization as a national surveillance system, we have ensured name-based GIS-enabled near real-time surveillance of 36 epidemic-prone diseases. E-Raktakosh, all the blood banks across the country, and online reservation systems application provides online appointment for government facilities across the country. And Mera Aspatal for giving feedback on health services provided by the hospital. Other well-known pan-India applications included e-Sanjeevani and COVID. E-Sanjeevani was largest telemedicine network, ensure free of cost online telemedicines, video calls to citizens. So far, more than 100 million teleconsultations have been conducted through this platform. The globally renowned COVID vaccine management platform has supported administration of more than 2.2 billion COVID-19 vaccine doses. Friends, yesterday, I have touched upon the 4 pillars on Ayushman Bharat. the Long Live India mission. Today, I would like to opportunity to delve deeper on the digital aspect of the Ayushman Bharat digital mission, which is cutting across all domains for enablement of digital health ecosystem in the country. Under ABDM, the government has initiated creation of registry for patients in the form of unique patients IDs, health provider registers, and health facility registers as an essential foundation for any health programs to be interoperable with other programs. More than 332 million unique patients IDs, more than 200,000 health facility registers, and more than 144,000 health professional registries have been created so far under ABDM. Taking forward, the government's focus of breaking the silos ABDM will lead to the creation of longitudinal health record of patients which can have been burning of continuum of care across primary, secondary, and tertiary levels of care. ABDM also enables newer technologies and advanced data analytics to be integrated with existing solutions aimed at avoiding repeated diagnostics, accurate diagnosis, precision medicines, increased quality of care, timely response in emergencies, and lowering out-of-pocket expenses. While India is already working toward creating an enabling ecosystem for digital health in country through various policy level reforms, implementation and scaling up of this digital intervention is parallelly focused often. Friends, even though we have utilized multiple technological intervention in health, we have still leveraged only the tip of the iceberg. Truly, digital transformation requires multi-pronged efforts with special emphasis on leveraging cutting-edge technologies such as artificial intelligence, machine learning, and both logic and AI-based clinical decision support system to achieve the overall vision of digital health ecosystem. Indian government has taken ambitious steps towards convergence of advanced technologies in the delivery of healthcare services in the country. Premier tertiary care institutions of the country like AIIMS Delhi, AIIMS Rishikesh, and PGI Chandigarh have been designated as the Center of Excellence for Artificial Intelligence in Healthcare, with an aim to enhance adoption and promotion of health data standards. The Center of Development of Advanced Computing, Pune, has been designed as the National Resource Center for AHR standards to achieve synergy between siloed and vertical national health program. A national public health observatory has now been established at Union Health Ministry level, with nodes at state and district level, which will yield the twin benefit of effective public health monitoring and health emergency management. Based on our learnings, I would like to highlight the three policy enablers which every government should prioritize. First would be digital architectural frameworks for a country for establishing a digital ecosystem. Secondly, government should ensure standardizations of data, focus on data security, privacy issues. Third, integration of multiple applications for data-driven policy making should be major focus globally. Government of India believes that digital tools have immense potential and can play a critical role in strengthening and transforming healthcare delivery system. At this juncture, it is crucial to converge our efforts toward building a culture of interoperability in development of digital solutions, not only at the country level, but also globally. Further, greater focus is required on supplementation of global investments instead of duplications in investments, and there is a need to create a unified global health architecture. Under the G20 motto of One Earth, One Family, One Future, India is working towards greater collaboration and sustained efforts across the digital health ecosystem. Leveraging its G20 presidency, India is also encouraging development of common global platforms for sharing of medical countermeasures, technical knowledge, digital infrastructure, and cost-effective digital health solution. I'm happy to note that this conference has brought together varied stakeholders from the global digital health community. These stakeholders must now ensure that the coordinated efforts are sustained and momentum built is carried forward. It should be our collaborative efforts to support each one at every stage for making these worlds a connected healthcare system without boundaries. Thank you. Thank you very much.
Thank you, Your Excellency, for highlighting the quantum leap that India has made and the many, many notable achievements that India has demonstrated.